everyone, so today we're going to be going over the Precision Analytical Dutch Test. Everything that you need will come inside this small green envelope. What I'm going to have you do is I'm going to have you take out all the contents. I have everything in front of me already, so we can go over what is included. Inside of this pamphlet, you will find a requisition form, a plastic bag with your test cards, as well as a shipping bag. The first thing that we are going to review is the requisition form. So the very first part of this requisition form you will be filling out is the patient information section right up here. This includes information about your name, date of birth, address, all that good stuff. Now below here, you'll notice there is a spot for you to fill out the sample collection dates and times. You will not have to fill that out or worry about that right away, but we will have you fill that out as you take your samples. To the left, there is a spot for females. So if you are a female, you will indicate the information here accordingly. Now right below here, there's a section if you are taking any hormones. You're going to go ahead and indicate the hormones that you are taking, as well as the route of administration for those hormones. If you are not taking any listed hormones, you can certainly just check mark off the box that's listed here, stating not taking any listed hormones. Now at the bottom, there are different prescriptions that are listed. If you are taking any of those prescriptions that are listed, you will go ahead and check mark off the prescriptions you are taking. Now we'll flip over to the back side. In this corner, we have disease states. So you will indicate if you do suspect you have any of the diseases, you suspect you do not have any of the diseases, or if you have been diagnosed with the diseases. We also have your fatigue level. So we will have you indicate the level in which your fatigue is for morning fatigue, afternoon fatigue, and evening fatigue on a scale from 0 to 3. Now below here are different conditions. So we have women and men. You're going to go ahead and take a look at the conditions that are listed, as well as the symptoms that may accompany those conditions. If you are experiencing any of those symptoms, you will circle the symptoms you experience and again rate those on a scale from 0 to 3. Additional symptoms are listed below here. So again, we will have you rate those symptoms on a scale from 0 to 3 of how much you experience them. To the right, we have which best describes you. So this is for your weight. So you're going to go ahead and indicate which best describes your weight. These bottom two sections, the top question is, what are the top issues you hope this test will help you resolve? That one is completely optional, so you do not need to fill that out, but it is up to you. The bottom one is for you to list any additional supplements or prescriptions that you are currently taking that was not listed on the front when you did your check marks. Once this has been completed, you can go ahead and fold this up and set this over to the side. Now what we're going to have you do is pick up this clear plastic bag. I'm going to have you take out all the cards that are inside of this plastic bag. On the second page of this pamphlet, it will say when to collect. We're going to have you take a look here at when to collect your samples. You will notice that on the back of each of these cards, it'll tell you at what time you are taking the samples. We will have you fill out your information that includes your first and last name, the date of your collection, as well as the time of your collection. For instance, sample 1 will be taken at dinner time or approximately 5 p.m. Sample 2 will be taken at bedtime or approximately 10 p.m. Sample 3 will be taken within 10 minutes upon you awakening. And sample 4 will be taken exactly 2 hours after you wake up. What a lot of our patients like to do is set a timer for that one so they know exactly 2 hours after they wake up. If you do happen to wake up in the middle of the night to use the restroom, there is an extra overnight sample card there for you. Again, you will just indicate the time and date that you took that sample. When you are taking your samples, what you're going to do is you're going to unfold it. On one end, you will notice a rougher texture paper with 2 little black lines on there. This is where you will collect your urine sample. You can either urinate directly onto this filter paper, or you can also urinate into a cup and dip the filter paper inside of the cup. Both of them work, whichever you would prefer. Once you have collected your sample, you're going to leave it out on your bathroom counter just like this to make sure that the sample does dry. We do want to make sure that this sample is dried for at least 24 hours before you do send these out. Now with the samples, we want to make sure that you refrain from any alcohol or caffeine consumption on the day that you have taken your samples. We also want to make sure that you do limit your total fluid intake to about 40 ounces. This is to ensure that your sample is not too dilute. Once your samples have dried for 24 hours, you can then package them right back up inside the plastic bag that they came in. You're going to take your shipping bag, place your samples inside of the shipping bag, and place your requisition form as well inside of the shipping bag. You will then seal the bag shut, and you will drop this off with any UPS facility or any shipping facility that ships UPS. As always, if you have any questions, you can certainly email us at office@drbotello.com or give us a phone call at 951-587-0100. Have a great one.